I don't usually post about this type of thing, so I'm usually just getting to the education, but this is the silliest little insurance company kerfluffle that I just had to share it. So, as an OBGYN, I will see patients for evaluation of masses or cysts on their ovaries. And if we are evaluating this, one of our goals, of course, is to see, do we think we're worried about this being an ovarian cancer? So, a test that we do, which is very straightforward, very much indicated, is something called a CA-125, which is cancer antigen 125. This is a blood test. And if it's elevated, we're more concerned about it being possibly an ovarian cancer. If it's low, we feel a bit more reassured. So when we order these tests, we put them in the computer and we link the test we're ordering to an assessment or diagnosis. So if I'm putting this in, I would put something like ovarian mass, ovarian cyst, and then I would order the test. Now here's where the kerfluffle comes in. If I'm seeing a patient who has Medicare, when I go to order this test, it will then give me a flag in the computer that says the insurance company will not pay for this test for that assessment. And it will then offer me some assessments that it does cover it for. And it's things such as malignant neoplasms, personal history of malignancy, ovarian malignancy, metastatic malignancy, mesothelioma. These are the type of things they cover it for. So I'm like, okay, so I'm getting the test to see if this cyst or mass is cancer, but you won't pay for it unless it's a cancer. But I don't know if it's a cancer unless I get the test, but you won't pay for the test unless it's cancer. Like, it doesn't make any sense, right? So what I end up doing is scrolling through their suggested diagnoses that they'll pay for it and trying to find something that's accurate, because I'm not going to put an inaccurate diagnosis in the chart. First of all, that's fraud. Secondly, I'm not going to put a cancer diagnosis in someone's chart if that's not the case. And I don't know yet because I haven't done the test or finished the workup. So I end up scrolling through trying to find some type of diagnosis that they will cover this test for that is somewhat accurate that I can do to get the test done. So this also leads you to the point of when you're waiting in the waiting room for the doctor and wonder why they're so behind. It's because we're jumping through hoops like this to try to get totally indicated and totally appropriate tests paid for our patients. Make it make sense.